Dr. Pablo Naranjo from Laser Clinic in Madrid. Today we are going to talk about acne scars, how to treat them. We know that in the past we had chemical peels like a very good way to target this stimulation of production of collagen by the fibroblasts. But we have now much better technologies to help us to achieve better results in less number of sessions with less risk. Which one are those technologies? Evidently, we started years ago with the CO2 fractional laser and RPO fractional laser. We moved then to the non-ablative fractional laser. And finally, a few years ago, we started with the ablative fractional radiofrequency. Which one are the benefits from this technology compared to the previous one? Firstly, we can do the treatment during the whole year. With the other technologies, we have the limitation of the solar irradiation. Second, we can treat the majority of the phototypes, even phototype 5 and 6. We are not able to do it before with the previous technologies. Third, we can treat small areas. So if the patient gains with just 5-10 acne scars, we are not forced to treat them the full face. So this is a huge benefit on the recovery time. And when we talk about recovery time, we are talking about 24 to 48 hours downtime. And if we help just the patient a bit with some technologies like LED or PRP, we can reduce to 12 hours the downtime. This is a huge benefit compared to the previous technologies, the CO2 fractional laser and any fractional laser, because with those technologies we have a downtime of minimum a week and a half. So those benefits are evident for the patient. Probably the only thing which is not as good as with the CO2 fractional laser is we're going to need a few more sessions. Instead of 2-3, we are going to go to 3-5 sessions spared by 1 month between them. So it means that for deep acne scars, we're going to need like half a year, 4, 5, 6 sessions spared by 1 month to achieve the best results. So which one are the difference between the previous fractional frequencies and the new generation, the one who have since a few months ago? So the benefits are related with 3 big things. Firstly, the new technologies improve scanners inside of the handpiece. Those scanners enable the treatment to be less painful. We are going to talk about non-painful treatments now with fractional frequency. Evidently, when the fractional frequency started 6 years ago, the treatment were painful and needed some topical anesthesia. Now we can apply with or without topical anesthesia depending on the parameters we program the device. Second, we're talking about scanners, but much more important, now the technology are nanofractional. Nanofractional means the electrodes are extremely small. It means that the damage in the epidermis is minimal. This damage in the epidermis is necessary. We need to do ablation and coagulation. The benefits of the fracturing or of the nanofracturing technology are evident. Now we damage less percentage of epidermis. We need to ablate epidermis and coagulate dermis for a regeneration of the collagen intradermal and the epidermis. But we want to ablate less than we coagulate. So with fractional radiofrequency, with nanofractional radiofrequency, we are able to ablate 7% and coagulate 22 to 25% of the papillary dermis. It means that with 2 or 3 passes, we are able to coagulate 50 to 75% of the dermis. So it means a huge production of collagen intradermal. With some ablation is also necessary. The recovery time, as I told you, will be very short, 24, maximum 48 hours. So does it mean that the treatment will be related only with this technology? We don't need other things? No. Like doctors, we need to do a proper diagnosis in our patients. So we have 3 kinds of acne scars: box acne scars, rolling acne scars, and ice pick acne scars. In the very deep one, ice pick acne scars, we're going to do some subcision. We can do it with a needle, or we can do it with therapy. But this previous step of the treatment is going to enable us to generate some space and to be able, after that, to stimulate the production of collagen by the fibroblast. This production of collagen is related with 2 things. Firstly, the heat shock proteins released by the endothelial walls when we achieve 60 to 62 degrees Celsius. Secondly, the inflammation process is going to generate edema, and the edema is going to stimulate the mechanoreceptors of the fibroblast to produce collagen. So there we have a double stimulation of the fibroblast. The 2 ways we have to stimulate the fibroblast to produce collagen. So we can talk about one of the most efficacy technology to stimulate fibroblasts for the production of collagen in papillary dermis. Can we compare them with the sophisticated CO2 and RPO fractional laser? Evidently, the result achieved can be similar, even same or better one, but with 1 or 2 sessions extra. So the patient will benefit with this technology if they are in good, healthy conditions. Evidently, we are going to treat patients who have acne scars since 50 years, 40 years ago, and the condition of the skin are not the proper one because they have a lack of organic silicium, a lack of zinc, or they have a huge oxidative stress due to their life, due to the way they eat, the exercise they do, or even due to the medication, like corticoids they take, the work will be more difficult. Evidently, in those patients, the protocols are going to be more sessions and we are going to be a bit more aggressive, so to put more energy in each one of those sessions. So we have done a short overview about the treatment of acne scars. We have seen that the technology gives us better results with less downtime, with less rings, and it's necessary sometimes to combine with other technologies to achieve the better results in our patients.